ladies and gentlemen. It's my privilege to be with you today morning, and I'm going to start with a video presentation which is going to introduce you to Nepal.
Along the great Himalayan range of mountains lies Nepal, which is considered mystic and sacred due to people's strong religious following. Nepal's 26 million people belong to dozens of different ethnic groups, but can be divided roughly into Hindu people who live mainly in the lowlands and Buddhist in the north and mid-hills. The country's southern plains shares an open border with India and the northern part with China along the Himalayan range. Nepal is home to the world's most imposing mountains, including the highest, the Mount Everest, and is today in the midst of political transformation after a decade of internal conflict. Economic indicators at a glance. Nepal's Human Development Index, Human Development Value, Nepal's per capita income, economic growth rate, gross domestic product, literacy rate and girl literacy stands at 57.4%. Nepal's health indicators: neonate mortality, infant mortality, under 5 mortality, maternal mortality ratio, 1 in 22 children die before their first birthday, and 1 in 19 children don't survive to see their 5th birthday. Fertility in the country has declined from 4.6 to 2.6 in the last 15 years. The good news is that we are on track to meet Millennium Development Goals 4 and 5.
That's where we are. And now I would like to say that under 5 mortality has declined remarkably in Nepal, which used to be 118. Now we have 54 per 1,000 live birth in the last 2 decades. Similar progress has been made in the field of maternal mortality ratio as well. 770 to 170 per 100,000 live births during the same period of 2 decades. Nepal's girls' education program, women empowerment, and the family planning initiatives are some contributors to reduce the maternal mortality. However, we have not made the same progress in reducing the newborn mortality. 1 newborn continues to die every half an hour in Nepal, which is really unacceptable. The challenges faced by the mothers and the newborns are many, and they are dying mainly due to the infections, intrapartum complications, and the premature birth. The painful and the tragic truth is that the most newborn deaths are preventable, such as getting mothers not to deliver at home where the environment may be unsafe, placing both mothers and the newborns at risk.
Maternal in Acham district. Here we meet 31-year-old Basanti Sarki. She has 5 children, 3 daughters and 2 sons, aged from 13 to 2. The 6th one is on the way. Finally, Lakshmi, the nurse, arrives.
That's what the situation, reaching to the unreached. The newborn birth you saw is something that challenges us in the remote part of Nepal. It was lucky that the baby girl survived, but the situation doesn't remain the same for everyone. To make it safe for mothers and the newborns, the government is working at the policy and the service delivery fronts, including the lowest community structures, with health volunteers reaching out to the individual households with information and the awareness. To begin with, the government of Nepal has increased its funding for health services over the years, and proportionately more investments are being made for primary levels of care where the need is the most. The National Vitamin A Program and the Community-Based Integrated Management of Childhood Illness are the programs that have been successful to reduce under 5 mortality, credit for which goes to the task shifting model we adopted. The previous speaker has also talked about the same. Learning from the 2 initiatives on task shifting, the model was taken up as a policy agenda and became a program approach for the auxiliary nurses, midwives, and the female community health volunteers. By task shifting, the midwives and the health volunteers who were given additional skills are able to provide the immediate care and services to the mothers and the newborns, a role that was previously limited to the professional health workers such as physicians and the nurses only. It was really a tough task to revert. In 2001, our Prime Minister launched the first situation analysis of the newborns in Nepal, following which we responded by drafting the first ever comprehensive national neonatal health strategy, reflecting our commitment to provide newborn survival. Responding quickly to the need, even as the strategy was being drafted, the government and its partner jointly piloted and generated evidences to address the major cause of newborn deaths before we lose the time. These pilots and the programs included the evidence-based intervention, such as introducing the birth preparedness package, promoting essential newborn care practices through mass media, improving coverage of institutional deliveries through maternity incentive programs, and cord care practices applying chlorhexidine, all of which are today contributing to better care of the newborns. The Morang Innovative Neonatal Intervention, we call it MINI, for example, demonstrated how community health workers were able to identify and manage the newborn infections, the result of which we have shared already globally and is being praised. The recognition Nepal received when winning the MDG 4 and 5 awards for reducing the child and the maternal mortality was credited to the female community health volunteers by the government. As recognition for our work for reproductive health, Nepal was also awarded the Resolve Award for innovative commitment to achieving the universal access to reproductive health in financing last year. However, knowing that good is not good when the better is possible, we are not resting. As much more needs to be done to improve the access to the quality service, particularly for underserved population and reaching to the unreached people, financially, socially excluded people. Fellow delegates, Nepal is also a learning country. We have taken learning from Bangladesh and India to design our unique and the comprehensive newborn care package, which is known as Community-Based Newborn Care Program. The program implemented between 2008 and 12 we have rich findings and learning for all of us working on the maternal and the newborn health. One of the key issues that emerged was the increased demand for the institutional deliveries, as people were making informed choices to go to the health facilities, resulting in overwhelming influx of the cases that was beyond our facilities' capacity to handle with the quality service. This challenge of disproportionate balance between demand and supply is something we need to work on to improve the quality services and win people's trust in the health facilities. I would like to present you in visual some snapshots of our program, which just I have shared with you. And there we are, after, say, a year of nearly 12 years, after the situation of Nepal and the situation analysis was done. And the action shots of people and the training which has just displayed. These snapshots of what you saw are in line with the government's commitment to the international community. Nepal made a commitment to the UN Secretary General's Global Action Plan for Women's and Children's Health at the Every Woman and Every Child Summit 2 years back. At the summit, our Prime Minister committed to recruit, train, and employ 10,000 additional skilled work attendants within 5 years to ensure the mother gets free maternity and the newborn services.
भन्नुहुन्थ्यो छातीमा त चाहिँ निमोनिया हुन्छ डर हुन्छ भन्नुहुन्थ्यो राम्रो छिटो स्याहार्नु भन्नुहुन्थ्यो
सासै नफेर्ने आँखा पनि नहेर्ने हात खुट्टा नचलाउने अनि मुख मात्रै फ्याक फ्याक बगाउने
अनि म दिल्ली सेक्सन पनि प्रयोग गरेको अनि मुखमा पनि नाकमा पनि सबै र्याल निकालेको पाइपबाट अनि उ सास पनि ब्यागमास पनि म गरेको त्यो दिँदाखेरि बल्ल बच्चाको अवस्था अलि राम्रो भयो
पहिला हामी जाँदाखेरि हामीले गर्ने बेला धेरै अगाडि थियो धेरै अगाडि हुँदा गाउँमा जाँदा जान बुझी थिएन मान्छेले कुकुर फुकाएर पनि लाइदिए अघि लट्ठीले पनि हिर्काए अहिले चाहिँ राम्रो छ जाँदा माया पनि गर्छन् आइन भन्छन् ढोका खुला लाउँछन्
आज आएर हामीले गर्वका साथ भन्न सक्छौँ हाम्रो बर्दै जिल्लामा विशेष गरी ठाकुद्रा गाविसको पनि हामीले त्यो डाटा हेर्यौँ भनेपछि 82% संस्थागत डेलिभरी भएको छ र यसले पनि के जनाउँछ भन्दाखेरि महिला स्वयंसेविकाको भूमिकाकै कारणले आज मातृ मृत्यु दर र नवजात शिशु मृत्यु दरको कमी भएको छ भन्ने हामीले पाएका छौँ।
Ladies and gentlemen, we have a vision for the future where every mother in Nepal will look forward for their newborn to experience the rice feeding ceremony at the first intake of solid food by a child around 5 to 6 months. Looking to the future with the hope and the optimism where no child will be born to die and we will be working on improving our in-house coordination to have a fully integrated maternal, newborn, and child health program. As a learning country, we will be revising the community-based newborn care program before we take it to a scale across the country. We have challenges, but we are headed in the right direction, such as the implementation of the multi-year nutrition plan this year, which has nutrition-sensitive specific plans for the neonates and the mothers. And I'm proud to share with the fellow delegates that the Nepal is one of the first to adopt the Global Scale-Up Nutrition Initiative, which is about fortifying nutrition for mothers and the fetus from conception to a child's second birthday. To meet the challenges of demand for services, the government is in the process of recruiting close to 15,000 additional health workers. It is also rolling out the Human Resource for Health Strategy Plan, which will address equitable distribution of health workers to balance supply and the demand. In conclusion, as a global citizen, I would like to make a call for collaboration and support to take this agenda forward to reach every mother and child in Nepal. This is the basic situation that we are moving forward. However, we are in the process of looking how best we can get the evidence-based result. And for that, we need the support from all the stakeholders, including the international communities. We are in the process of learning as well as doing, and we definitely look for how best we can move forward to reduce the further death of the neonates in the time to come, because then it needs to be planned well with the family planning, and we are in the process of doing that, because when we say the family planning, it is not only the family planning, it is the social planning, it is the cultural planning, it is a national planning. And until we have these plannings on place, I think it will be difficult for us to move forward. Now, I appeal to all the partners to look into it and see that how best we can really move in this direction to achieve the reduction in the neonatal mortality that we are over here. At the same time, I express my deep gratitude to all the partners who have always supported the government of Nepal initiatives for the mothers and the newborn. Thank you. Thank you very much.